How to get rid of leg cramps. Leg cramps, sometimes called Charlie horses, come on quickly, can last for a few seconds to several minutes, and can be quite painful. While any muscle can spasm or cramp, the muscles that are most commonly involved in leg cramps are the calf muscles in the lower part of the leg, the hamstrings, or the muscles along the back of the thigh, and the quadriceps, found along the front of the thigh. Quickly treating the cramp muscle causes the pain to stop, but sometimes you may need to take additional steps if you have frequent leg cramps. 1. Getting immediate relief. Stretch the cramp muscle. Muscle cramps are sudden and unexpected contractions or spasms of a muscle. To stop the cramp quickly, the cramp muscle needs to be stretched. By stretching the muscle, you are preventing it from remaining in the contracted or cramped position. Stretching a cramped muscle works best if you can hold the stretched position for about a minute, or until the cramp feels better. You may need to repeat the stretched position if you feel the cramp returning. Stretch the calf muscle. Put your weight on the leg that has the cramp, and slightly bend your knee, while keeping your foot flat on the floor. Another way to stretch the calf muscle is to face a wall, stand a short distance away, and lean against the wall using your hands for support. Keep your cramped leg straight, and the foot and heel on the floor, as you lean your upper body into the wall. Stretch the hamstring muscle. To stretch your hamstring, or back thigh muscle, perform the above exercise done while seated, pulling your foot towards your head and chest area. You can also stretch your hamstring by lying on your back, and pulling your knees to your chest. If someone is available, they can help by gently putting additional pressure on your knees, forcing them a little closer to your chest. Stretch your quadriceps muscle. Have a chair or wall nearby to steady yourself. Bend the knee of your cramped leg, and grab your foot. Pull your foot up towards your lower back and buttocks area. Massage the area of your leg that is cramping. Gently massaging the cramped muscle can help it to relax. Apply heat. Using methods to apply warmth to the area can help the muscle to relax and soothe the pain from the cramp. Methods used to apply heat include using a warm towel, a heating pad, or taking a warm bath or shower. Most people feel relief when warmth is applied to a cramped muscle, plus it improves circulation. Consider using ice. Some people report benefit with applications of ice to a cramped muscle. Determine what works best for you. Avoid placing the ice directly on the skin. Fill a small to medium-sized baggie with ice, and add enough water to barely cover the ice. Squeeze the air out, seal it well, then wrap the baggie with damp towel, and apply it to the area. Another quick option is to use a bag of frozen veggies, like peas or corn. Wrap the package in a damp towel and apply it to the area. 2. Preventing leg cramps. Understand why you are having leg cramps. To prevent future painful episodes, it is helpful to understand what happened that triggered the cramp. Talk to your doctor. If you have repeated problems with leg cramps, if you are elderly, have diabetes or liver disease, nerve compression caused by problems in your lower back, poor circulation in your legs, or thyroid disease, you may be at greater risk of developing leg cramps. Adjust your exercise routines. Don't overdo it. Exercise is important to your overall health, but if you are having leg cramps, then your body is having trouble keeping up with your routine. Adjust your activity to include exercises or activities that use other muscle groups, as your leg muscles adjust to the level of intensity you are working towards. Shorten your workout duration. Muscle cramps are more common as the muscles get fatigued, fluids become depleted, and electrolytes in the system may not be adequate. All of these factors can happen simultaneously when your workouts are lengthy. Stay hydrated. One of the most common causes of muscle cramps is dehydration during exercise or sporting activities, especially in extreme heat. Increase the amount of water you drink just before and during your activities. Even drinking water while you are having a cramp can help to relieve it. Water alone may not be enough. During heavy exercise, your body is also using electrolytes that need to be replenished. Depleting electrolytes in your body causes muscle cramps. Provide more electrolytes in your system by drinking sports drinks, using salt tablets, and eating more foods that contain electrolytes, such as bananas and oranges. Every person is different, so there is no method to determine the exact amount of each electrolyte you would need to consume in order to prevent leg cramps. Adjust your diet. Eat foods that are rich in minerals including calcium, magnesium, potassium, and sodium. Examples of foods that are rich in calcium and magnesium include milk, fish, meats, eggs, and fruit. Include foods in your diet each day that contain potassium. Some foods rich in potassium include bananas, fish, avocados, and potatoes. Also be sure to get enough salt in your diet. If the weather is hot, and you are sweating from the warmer temperatures, you may want to consider drinking a sports drink each day that contains electrolytes, including sodium, or sodium chloride. Stretch before and after you exercise. Stretching those muscles before you begin helps them to warm up, improve blood flow to the area, and improve overall flexibility. Stretching your leg muscles once you have finished exercising helps to relieve muscle fatigue and soreness. Proper stretching can help your muscle tissue to relax, release any unwanted chemicals that might have accumulated during your workout, and help to provide adequate blood flow to the muscle tissue. Anticipate leg cramps from swimming. While swimming is great exercise, it is also a common cause of leg cramps. Take proper safety steps as you start swimming, especially if you do not swim year-round, and if you are swimming in colder water. Stretch before bedtime. Often, leg cramps occur at night. If this is happening to you, then stretch your leg muscles before you go to bed, and be sure you are adequately hydrated. Light exercise just before bed may also help to avoid the leg cramps at night. Take a short walk, or ride a stationary bike for a few minutes prior to going to bed. 3. Knowing when to seek medical attention. Talk to your doctor if you have a medical condition. Medical illnesses can put you at higher risk of leg cramps, especially if you alter your exercise routine. Some of these medical conditions include diabetes, liver problems, thyroid disease, obesity, or compressed nerves. Leg cramps are usually caused by muscle fatigue. They can also be caused by low sodium levels or other electrolytes.